Nursing is a healthcare profession focused on the care of individuals, families, and communities in order to attain, maintain, or recover optimal health and quality of life from birth to the end of life. The highly respected profession dates back before the early 1900s.
The nursing field is a professional practice-based discipline that's been in existence since Florence Nightingale, and in fact we could even go back earlier than that to the Crusades, whenever people needed help. Nursing here in the United States began in the late 1800s.
The general public doesn't have a great understanding of the full scope of practice regarding nurses today. For instance, many people don't understand that medical administration is about assessment and evaluation of the effectiveness of medication.
One of the things that nurses have traditionally been known for is to educate patients. The role of the nurse was to do for the patient what the patient would normally do for themselves if they were able to do so.
Nurses today do things both in a clinical setting in the hospital where patients are acutely ill as members of a multidisciplinary team. They work in primary care practice, taking care of conditions that are recurring, fairly stabilized chronic conditions like diabetes, take care of children, doing their immunizations, their school physicals. They also are working in home health, taking care of people who are living at home and helping them to be as independent as possible.
There are others who believe that a nurse is in some way subservient to the doctor, when in reality, doctors and nurses work together as equal parts of the medical team.
The research shows us that when there's a team effort, when you've got the right people, meaning the right specialty area, working with the patient, whatever that unit of care is, the outcomes are enhanced. Relationships between providers, in my mind, is what makes a difference for patients. If providers are territorial, that's not good patient care.
It takes a certain kind of person with special dedication to helping others to become a nurse.
I feel that some of the successful character traits that nurses have to have are being compassionate, caring.
Caring and comfort are just so important in a nurse's job.
In addition to having compassion for fellow man, a nurse must follow a rigid field of study in order to get the proper licensing to become a nurse.
Schools of nursing, they have a 4-year bachelor's program. There's master's programs to be a nurse practitioner or educator. There's PhD programs, and there's DNP programs as well.
The word nurse means it could be a registered nurse, it could be a licensed practical nurse, it could be a nurse's aide. The only professional title is that of the registered nurse. The aide is somebody who assists the registered nurse. The licensed practical nurse is somebody who works under the direction of the professional nurse. But the registered nurse is the official title of professional nursing practice in the United States today.
Nurses can be found throughout the medical community. Many nurses, such as graduates from the University of Connecticut, work on the sciences and discovery mode. While all are rich in diverse, scholarly subjects, many go on and receive doctorates to become advanced practice nurses.
There are different types of clinical rotations within the School of Nursing. You do maternity, pediatrics, long-term health care. There are things as community health.
Our advanced nurse practitioners are individuals who are able to prescribe medications, independently manage patients.
The demand for nursing continues to grow as society grows.
Our advanced practice nurse graduates find jobs immediately. Employers seek them and encourage them to come and work for them. Nursing is a profession because it's trusted.